So hi everybody, you're here on Injury Concepts. Really important one today for a number of reasons. One of which is a lot of people that come to see chiropractors and physical therapists and people like myself are coming in with low back pain. And I was scouring around the internet like you guys do, looking at what's out there, what's available, and I found an unbelievable video, which is the current link on my old website, that was actually provided for the people of Canada in their socialized system about back pain, and it was a really well done video called The Red Flags of Back Pain, such that if somebody woke up in the morning in Canada, they would be instructed to watch this video to see if they could do a little bit of self-diagnosis and mostly to allay fears. A lot of you guys are going to wake up or even after a workout or whatever it might be, and you're going to experience maybe mild to moderate to severe back pain, and you're going to be concerned, and concern is valid. Particularly in the video that we're going to make right now, which is the red flags, the stuff that you should be concerned about. But most of the time, of course, you're not going to be dealing with cancer or some of the more ominous conditions that can lead to back pain. But we don't want to be foolish. We don't want to brush off the possibility that these things might be going on. But that said, I don't think that we need to be rushing off to the doctor every time our back hurts a little bit. So here's some great information on this particular video in regards to the red flags and some of the features of that video. One of them is going to be persistent pain. So this would be pain that's lasting more than a few weeks. If you have back pain that is moderate to severe, and it's lasting more than a week or so, you should go see a doctor immediately. But make sure that when you go to see the doctor that they don't rush you into MRIs and into some of these things immediately. They're doing actually a physical exam, taking a good history-taking session. One of the major, again, variables on back pain is night pain. So I remember in school we learned about night pain and the ominous features of night pain. So for instance, if you have a low back problem like most people do, that's disc related, that's the intervertebral disc between your vertebrae, you're going to feel localized pain. Generally speaking, when you get into bed at night, in the sense that you're not moving around in bed at night, you can resolve it by maybe putting your feet up on some pillows and trying to find a comfortable position on your side. There's various things. So the night pain would be that where it's sort of unremitting and there's no way you can find any comfort. So definitely heed that warning and make a visit with a doctor the following day if night pain is part of the presentation. We want to get some imaging studies on that and make sure we're going to rule out bone cancer or cancer that might be pressing upon something. Again, very rare. Don't want anybody to watch this video with the takeaway of, oh my God, I have cancer, because most of you don't. But to be prudent about it, that's what this video is about. So persistent pain, lasting too long. You're one of those tough guys that says, no, this is going to go away, and a few weeks later you still have it. Don't be foolish any longer. Go get it looked at. Night pain. That would be something, again, that would probably come about very randomly. You might probably not have a mechanism of injury. Another big feature of back pain that might be more ominous is, hey, I don't know what I did. All of a sudden my back hurts. I didn't lift anything wrong. I haven't gone to the gym. I'm not overweight or chronically lazy, since that can cause sort of idiopathic back pain due to stagnation of fluids and inflammation. Poorly localized is another one. Oftentimes I'll have a patient, and one of the big warning signs that I've learned over the years is a patient might point to a certain part of their body and say, I feel the pain there. And I will start palpating, and I'll initially touch it, and then all of a sudden the patient will go, well, you're not on it anymore. And then I'll move and I'll be on it again. And then they'll say, well, you're not on it again. So when I put poorly localized, this is a palpation skill. So if you can have somebody in your home, one of your loved one or friend, push on the pain and it stays localized in that one spot, that's a good thing. It's probably a muscle spasm, maybe related to a deep disc pathology, which is a very common mechanism of a low back pain. But when your friend touches it and all of a sudden you're like, well, no, you're not on it, and they move around and they try to find it and then they find it again and then it's gone again, that would be the thing to look for as one of the red flags of low back pain, poorly localized pain. You'll see this quite often actually in the mid back and a few features. I'll probably do it on another video. And then unexplained weight loss, which is always the classic for cancer or for some of the more ominous features of any health problem, are going to be that these tumors are demanding on your body. They're taking resources. So you might have sort of unexplained weight loss. These are not all the features of red flags of low back pain, but there's some of the classic ones. There's some of the ones that you want to be considering if your back pain isn't going away in a short period of time. Again, by all means, these videos are really being produced, obviously, to save you time and money. They're not perfect. Nothing in healthcare is. Diagnosis is an art. It's a science. It's a combination of variables. So I don't want this to completely replace going to a visit with the doctor. And I also don't want any liability for people that are only relying upon this video as well. But being that a majority of people with low back pain are not dealing with cancer or any ominous medical conditions, I think it's a great way to start with these basic features of red flags of low back pain. So take care.